Hello. My name is Simone Perry, and I am an able-bodied working adult. I am also a single parent of 2 girls, 7 and 4 years old, and we depend on Medicaid to meet our health care needs. I am also a community health care manager here in Greeley with a caseload of 200 people who are not so able-bodied, who also depend on Medicaid to meet their health care needs. I understand that this question has been brought up several times, but I have not yet heard an answer. Sir, what are you going to do to ensure that my family is able to have health care and that the 200 people on my caseload, all of whom I care very much about, how are you going to ensure that they do not lose their coverage?
Again, we have to make sure that these programs are sustainable. With the $20 trillion... So, thank you for giving me a chance to answer. So we've talked about different ideas that we give the states more flexibility in how to run their Medicaid programs. We've talked about a series of 1332 waivers that would allow the states to run their Medicaid program the way they see fit. That they could run a program designed here locally, not out of Washington, D.C. 1115 programs, that's a section of the statute that would allow some of the dollars that we have available to be used to create insurance options for people in Medicaid that would provide affordable insurance, that would provide them with access to more doctors, higher reimbursed doctors, and I believe you'd have better care as a result of that. There are things that we can work together to do this with. And if you look at some of the amendments we worked on, we tried to do just that, and we'll continue to try to do just that. During this debate, start of the debate, several months ago, I talked about making sure that anything that involves Medicaid should have a transition period to make sure that the states are able to implement a program that best fits their needs. I'm going to go back and show another chart here. And I know these are real popular here, I can tell.
Never mind.
Well, look, I'm going to address that right now. I know, raise your hands again if you support single payer. I do not support single payer system. I do not support socialized medicine. That is not the way this country. So if you look at this right here, you can see discretionary interest in, and I'll just say this, last year in 2016 there was a ballot measure asking whether the people of Colorado wanted to go to a single payer system. It was defeated 80% to 20%. So you can see here the increase in some of our mandatory spending programs, Medicaid, Medicare, Social Security, and interest payments. What happens when this continues to increase and we have no way to squeeze it all in the budget? That's what I'm concerned about for the woman who asked the question and her children. We have to make sure that these programs are available. And again, going back to the ability to work together, even if we disagree, is extremely important. We cannot shout each other down in this country.